Colon cancer is one of the leading causes of cancer among men and women in the United States. And fortunately, it goes through a long precancerous phase that has been estimated to be as long as 5+ years. This gives us an opportunity to remove the offending lesion, which in this case is called an adenomatous polyp. We start scoping at 10 years before the index case in the family, or age 40, whichever occurs first.
Well, I went to another gastroenterologist who did a colonoscopy and was very concerned with what he saw. He said, I'm not so sure that these polyps are benign. And I said, well, what do I do now? He said, well, you have to find a good colon rectal specialist. So we looked around and we got recommended to Dr. Robert Cloud.
Chuck had no symptoms. His hemoccult test, which detects hidden blood in the stool, was negative. So he was basically coming in to do something that was recommended at the age that he was at the time.
I was a little concerned because I wasn't too sure why I had to be in the hospital to have polyps removed, because I'd had them before. So he allayed my feelings about getting upset. He said, be all right, give it 3 days and we'll send you home, and then we'll have you come back and have another colonoscopy within a year.
What we usually do is set them up for a follow-up colonoscopy on the same day that they have surgery, because there's a small chance that we can get it out through the scope and avoid surgery as long as the lesion is totally benign.
Colonoscopies themselves are really easy. You take a little prep day before, and then you completely eliminate everything, and then when you go in to see the doctor, he gives you a little bit of Versed, and all of a sudden you're sound asleep, you don't know what's going on. When you wake up, it's all over. You can't even remember what had happened.
The subsequent pathology came back as benign precancerous villus adenoma. And so basically, Chuck avoided cancer by undergoing screening colonoscopy.
And the end result is colonoscopies can change your life as far as any problems you might have with polyps. If you're thinking about it, if you've been told, do it. It's the best thing. And Dr. Robert Cloud is the guy. He's my man, and he always will be.